What happens when a pregnant woman needs emergency surgery that requires general anesthesia, and why this situation is a big deal? When someone's pregnant, especially in the third trimester, their body is very different. The lung volumes are smaller because the uterus pushes up, oxygen demand is higher, and the airway is harder to manage. This means intubation is riskier and oxygen levels drop faster. The anesthetics affect two people, the mom and the fetus. Some meds can cross the placenta, and depending on the dose, timing, and the specific drug, they can affect fetal development or even heart rate and tone during surgery. Current research shows that benzodiazepines like midazolam are linked to potential cleft palate risk early in pregnancy, so we try to limit them. Nitrous oxide has a theoretical concern about DNA synthesis, but there is no definitive proof in humans. Opioids are generally considered safer, but high doses near delivery can cause neonatal respiratory depression. Ketamine has some animal studies showing potential neurotoxicity in developing brains, but human data is limited. Volatile anesthetics like sevoflurane or isoflurane do cross the placenta. While they're generally considered safe in short-term use, there is some concern from animal studies about neurodevelopmental changes with prolonged exposure. With human data, it's still unclear. We don't have a lot of high-quality studies on pregnant women and general anesthesia. Why? Because doing randomized trials on pregnant women, especially in emergencies, is unethical. We can't randomize a fetus to potential harm, so we mostly rely on case reports, observational data, and animal studies. So in emergencies, we balance the risk of delaying surgery against the risk of anesthesia. We use the lowest effective doses, keep mom stable, avoid certain meds when possible, and always involve the OB and neonatology team if the fetus is viable. If you're pregnant and facing surgery, it's scary, but the goal is always to protect both lives. Anesthesiologists plan everything around that. Comment below and follow for more anesthesia-related content.